Hi, I'm Gary White for Channel 6, Central Kentucky Television, and I'm here with Jennifer Osborne, who is the health strategist for Marion, Washington, and Nelson counties with the Lincoln Trail District Health Departments in each of our 3 counties. And today we're going to talk about vaping.
Vaping.
Yes. And there's always something to talk about with health, right?
There's always something to talk about, and I think with vaping, everything changes daily. So,
yes.
You know, what I say today may not be the case tomorrow, and it probably wasn't the case yesterday, but yeah. We will definitely delve into it.
And so vaping, let's talk a little bit about what that is to begin with. Before we were talking, you know, I had said to you, I think that's something just the last couple of years, but you were saying it's been around for about 10 years.
Right. The ability to vape has been around for probably at least 10 years, but the amount of vaping that is going on and the amount of products that are available for people that want to vape has really kicked up a notch in the past couple of years, especially since 2017. Yes,
and that's with marketing with some different companies, correct?
Right, correct. And everybody has probably heard the name Juul. They're in the news a lot, but since that product hit the market, we've really seen an increase, especially in youth who are vaping, just because of the attractiveness of the device and the flavors that are able to be put into those devices. That's really what has caused the uptick in the numbers.
Let's take a look. You have some of the different items here. What actually, when we talk about vaping, what are people doing?
So when people are vaping, there is a liquid that is put into the vaping device. An e-liquid is what it's called. So they put the liquid into the device, and then they, basically puff on it like they would a cigarette that they did in the past. The difference is the product is heated. It is heated. It produces what's considered an aerosol, which does contain chemicals. It is proven that the aerosols that come out of these products do contain chemicals, very similar to some of the chemicals that were in cigarette smoke. Mm-hmm. So it produces an aerosol. They inhale. Mm-hmm. Obviously, there's also secondhand aerosol, the same way as there's secondhand smoke with traditional tobacco cigarettes. But they're able to put any number, any kind of flavor of product into the vaping devices. This is one which is, you may see people have something like this.
Right.
There's some that are larger. There's also some that are even bigger than this that people have modified. But this is what we're seeing more and more of with our youth. This is a Juul product, which if you didn't know the difference, you would probably think is just a USB, a flash drive that you put into your computer, and that's actually how it's charged. There's a charger that you can charge through your USB port. But then you have this little pod, that's what that's called, and you can purchase the pods that are already pre-filled with liquids of different flavorings, or you can purchase empty pods, and you can buy any kind of flavoring that you want. It doesn't have to be a Juul flavor. It can be any kind of other product flavoring, and put that into the pod and use it that way.
Okay, so you can refill your pods.
You can buy pods that are refillable. Mm-hmm. This one was not a refillable one, but you can buy pods that can be refilled, yes. And then, you have some that are similar to Juul that are probably less expensive for some of our youth to get their hands on than Juul, but that look very similar.
Right.
Yeah.
And they are quite small.
Right.
Yeah.
This is so tiny. Yeah, and so it's easily hidden. Mm-hmm. And that makes it difficult to know when youth are using them. If we always tell parents, if you smell if you go into your kid's room and there's this fruity flavor or sweet flavor smell or the scent, then it may be likely that they've been using the product. It doesn't produce, some of these products produce that great big huge cloud of vapor or aerosol that you see. These don't do that.
Okay.
So that's another reason why it's very easy to conceal.
Absolutely. And we are talking a lot about youth because they are, the number of youth, I think there's this survey conducted or something.
Right.
It wasn't maybe nationally, I'm not sure. But about 25% of youth.
Right. One out of every 4 are using or have used a vaping product. Yeah.
And when I first started hearing about vaping, they were talking about it was kind of an alternative to cigarettes and was billed as, by some people, as a better option, and still is by the vaping companies. But that has not been proven to be accurate.
That has not been proven. In order for a product to be deemed as a cessation tool, as a nicotine or tobacco cessation tool, obviously there has to be a lot of research and science put in behind it, and it has to be approved by the FDA as a cessation tool. None of these products have been approved by the FDA as a cessation product. And one of the reasons why some people feel like it is a safer alternative is because that the companies are leading you to believe that, when in reality they're really legally not allowed to say that these products are cessation tools. The other thing is, over 99% of these products contain nicotine.
Right. We were talking, like, you have this little piece here.
Right.
This, when filled, contains about a pack of cigarettes.
That pod is equal to about a pack of cigarettes. Now, it also is going to depend on which kind of liquid you put in there. You know, we can go and purchase so many different brands of liquids. A dual pod has been shown to equal to about a pack of cigarettes. Now, if I were to go and purchase this liquid and pour this into a pod, it may be more than one pack of cigarettes. It might be less. So it's very difficult, because the market is so huge with these products, and it's just become inundated with, you know, knockoffs, I guess, if you want to call it that.
And not completely regulated, potentially, too, because it is a newer thing. And we're learning, as Jennifer said, learning new things
every
daily.
day. There is something new. there are these, I should have brought it with me, but there is a product, and I forget the name of it, but it looks like an Apple Watch. It looks like an Apple Watch, and it is a vape. You can pull the little thing off of it and use it as a vape. So.
And also, though, with this pod, as we said, it's about a pack of cigarettes a day. Some people may use one pod a week, somebody may use one pod a day, some people may use 5 pods in a day, or what have you, and that could be then equivalent to about 5 packs of cigarettes.
So look at how quickly someone, and especially if I keep going back to our youth, can become addicted to nicotine, and then they don't know how to quit, and then, you know, they go to school and they get in trouble for doing this, when in reality they need help to quit, because they're hooked. They're addicted at that point. Because,
as with cigarettes, nicotine is the addicting element.
Right, absolutely. There are other things that can be vaped through these products too. We mentioned that earlier. THC can be vaped. THC is the drug that's found in marijuana. We know that CBDs can be vaped through these products as well. Some of the cases nationally that you've heard about on the news have been THC, but some of them have been pure nicotine products too.
Yeah, and we want to talk about them too, because right now a lot of the media information that people are getting on vaping is with regards to disease, right? The vaping, the pulmonary illness that we're seeing reported across the country due to vaping, those numbers are going up constantly. I believe at the end of last week, across the United States, there have been at least 1,300 reported cases. Here in Kentucky, as of last week, there have been 28 reported cases of that pulmonary illness. Obviously, they all have to be confirmed, but we've also seen 26 deaths across the nation from this particular illness. And we don't have the exact details as to whether any of those 28 cases in Kentucky are in our Marion County, Washington County, or Nelson County area, but they have been here in Kentucky, and they could potentially end up there. And there are people in Marion,
Nelson, and Washington counties vaping. So,
absolutely. Now, when you talk about there have been deaths from this as well, the actual cause is still unknown. They don't know why people are...
They are still studying all of those cases. Several of the cases that have been confirmed, they know have contained THC. A lot of the cases that they're seeing come from products that are from the black market, but there is not, I don't think they have found one single factor in each of those cases that is consistent across the board. So we can't really come out and say don't do this because this is what's causing it, or don't use this product because that's the one that's causing it, because right now there's not one single thing that has been consistent across the board in all of those cases.
Right, and it's still being investigated.
Right.
But there are several people getting this, so. Now, when we talk about vaping too, and we talk about it in schools, all of our school districts throughout Marion, Washington, and Johnson counties are smoke-free.
That's correct. All of the school districts and even the private schools in the area as well do have smoke-free campuses that do include vapor products, so they shouldn't be using on campus. Students, staff, adults, everyone. That policy does include everybody, even visitors.
Now, how about when we talk about the smoke-free ordinances as well? In Bardstown, there is one in our area.
Right.
Does that include vaping, or is that strictly cigarettes?
Bardstown's ordinance does include e-cigarettes and includes vaping.
Okay.
Yeah.
And we talk about e-cigarettes, that is vaping, right? They're kind of synonymous.
Right.
They are the same thing.
And kids probably, a lot of kids probably don't even call it vaping. They'll call it juuling.
Juuling, because they have the brand name.
So if you ask a kid, do you use an e-cigarette? They'll probably say, no, I don't use an e-cigarette, because that's not what they call it.
Now, is it illegal for merchants to be selling these products to anyone under the age of 18?
Yes, these are still considered to be tobacco products because they contain nicotine. So anybody under age 18 should not even have these in their possession. They should not be able to go and purchase it. And yes, there are fines for merchants that are caught selling to young people, and not just the store, but the clerks can be fined for selling it to young people if they're caught.
Now, you are going to be having programs in our 3 counties as well to kind of educate the public on vaping. And,
so Lincoln Trail District Health Department is setting up forums in each of our counties. So in Marion and Nelson and Washington County, those are the areas that I cover. We are going to be doing forums. The first one that we have scheduled is in Washington County, and we're very grateful to Washington County Public Schools for partnering with us on that. The forum is going to be October 24th. At 6 p.m. at the Washington County Tel Center, which I believe is the old Washington County Elementary School. That forum we will have, I will be there to talk about the products and the trends that we're seeing with the youth. It is open to the public, so anyone can attend. We are kind of, our target audience are parents and adults who may not get what all of this is, because it is so new, and there's something new every day with these products. But we do target parents and adults, community members, anybody that wants to attend. I will be there to talk about this, the products and the trends. We also have Monica Mundy with the Department for Public Health. She's part of the Kentucky Tobacco Prevention and Cessation Program. She's going to come and talk about youth prevention and provide resources for parents that may be looking for ways to help their youth quit these products. And then Dr. Diane Thomas with Lebanon Pediatrics is going to come and talk about the health effects of these products and vaping in general.
Okay. And that's going to be in Washington County? That
one is in Washington County, October 24th at 6. Marion County's forum is going to be set up the same exact way, and it is going to be on November the 14th at 6 p.m. at the Marion County Extension Office.
Okay. And then we'll have information on Nelson County, which I think you're looking for December timeframe for that, right? But we'll let you know when we get information on that one as well, because it's for everybody to be educated on this. And with the deaths and the sicknesses that we're seeing, are we seeing more across the nation? Is it young people, older people, just in general?
So as far as the deaths, or the 26 deaths that have occurred, it is ranged in age from 17 to 75.
Okay. However,
80% of the cases that have been reported have been in people under the age of 35. Really? So it is it is hitting our youth more, and it's primarily because our youth are using these more.
Absolutely. Yeah. All right. So if you see these things, and you can let the people know that they are not good for people to be using.
And the CDC, at this point recommends that you stop. If you're using these products, it's recommended that that you stop use, which is easier said than done because what do they contain? They contain nicotine. It's an addictive drug. But for any help with quitting, Kentucky does have a great resource with the 1-800-QUIT-NOW. Our quit line is a great resource for people that are looking to quit, and they do serve people all the way down to age 15. So that resource is there.
And is the cessation program the same for quitting this as it is for a cigarette? Because it's the nicotine that you're fighting, right?
Correct.
And also, what you had mentioned too beforehand is what you're finding is a lot of young people are being brought into the smoking or nicotine addiction through these products as opposed to actual cigarettes.
Right. For years we've worked so hard to get smoking rates down with our youth, and they had almost gotten to a point where they were at an all-time low, and then this stuff hit the market, and now we're seeing numbers of youth using nicotine go way up, unfortunately. So it's kind of like cigarettes were gone, now we've got this to deal with.
Right. How long does it take for somebody to get addicted when they start? Does that vary?
It does. It varies. But whenever you have products that contain, that it's pretty highly concentrated nicotine, it wouldn't take long. Yeah. And we always say, don't even start. You're so much better off, so don't even start. But if you have started these products, there are resources available to help you quit.
Great. And again, I've been talking with Jennifer Osborne with the Marion, Washington, and Nelson County Health Departments, Lincoln Trail District Health Department. She's the health strategist. Talking about vaping. Program is coming up at the end of October in Washington County, and then mid-November, October 24th and November 14th in Marion and Washington counties for vaping, and then there will be one in Nelson County as well. And contact the health department if you have any other questions or if you need information on strategies for ending as well. So thank you very much.
Thank you.
All right, it's been Gary White for Channel 6 Central Kentucky Television.